So first I'm going to start by looking at your face to see if you're in any discomfort or any distress whatsoever. It doesn't look like you are. Next, I'm going to ask you your name. Could you tell me your name, please?
Emily.
Okay, Emily, could you tell me where you are right now?
Simmons College.
And how about the month and the year that we're in right now?
March 2015.
Okay, very good. Next, I'm also going to assess your dressing, your grooming, and your hygiene. You're well dressed for this examination. And next, we're going to move on to the skin exam. I'll be commenting on your skin throughout the examination. If I see any lesions or any scars, I'll comment on them and I'll describe them, okay? So I can see that your skin is evenly pigmented, nice and fair. I see that you have scattered macules, also known as freckles, on your face and on your arms. I have a few on your legs as well. I'm going to be looking at the texture of your skin. It's nice and smooth. The temperature, as well as the moisture of your skin. I'm going to pinch your skin a little bit. And it should go right back to where it started. Just that shows that your skin is well hydrated. Next, I'm going to have you stick out your hands. I want to look at your nails. I'm just going to look at the shape of your nails, looking for any lesions, also looking at the hygiene of your nails. Okay, that looks good. I'm going to check capillary refill. That just checks perfusion, and the blood should rush right back in 2 to 3 seconds. Okay? All right, your nails look good. So that concludes the examination of the skin. Next, I'm going to look at your head, first starting with your scalp. I'm just going to run my hands through your hair, checking your scalp for any lesions or any nodules. All right, I don't feel anything. And your hair texture feels nice and silky, and the distribution is pretty even. So that looks good. That concludes the examination of the head. Next, we're moving on to your eyes. So I'm looking at your eyelids first, looking at the direction of your lashes, to see that they're upturned, and I see that they are. Next, I'm looking at your lids for any ptosis, which means drooping. I'm also looking for redness, edema, or swelling. Redness is also called erythema. Next, I'm looking at your conjunctiva. Could you look up for me? Bulbar and palpebral. And those look good as well. I'm also going to be assessing your sclera. These should be pearly white, and yours are, I see, mild injection, but that's probably because you're wearing contacts. But otherwise, it looks good. Okay? So next, I'm going to be looking at your corneas. I'm looking for any scratching, any scarring, or any arcus. Okay? To do this, I'm going to walk around to the side and shine my light. All right? Just look straight ahead for me. Very good. And now for the left eye. Very good. No scarring on your corneas. Now we're going to be looking at your irises. So I see that you have light green eyes. I'm just going to be looking for uniformity of color throughout each iris. It looks pretty good. Nice and uniform. So next, Emily, I'm going to be assessing your pupils. First, I'm going to assess them to see that they're regular, round, equal, and also I'm going to assess the size to see that they're normal size, okay?
Okay.
To do that, I'm just going to use this chart right here. It has a guide. And your pupils are about 5 millimeters, and that is normal.
Good.
Okay? Perfect. Next, I'm going to assess your pupils' response to light. First, I'm going to do direct response, which means that when I shine this light right here in each pupil, it should constrict. Okay? I'm going to start with your right pupil first. And just look right at me. Perfect. Very good. So that was direct response to light.
Did it constrict?
It did constrict. Very good. Next, I'm assessing consensual response to light. So when I shine my light in your right pupil, your left pupil should constrict as well. Okay? I'm going to block the light when I do this, all right?
Okay.
Okay, so first, your right pupil. Very good. Very good. So your eyes have both direct and consensual response to light, and that is normal. Okay? Moving on, I'm going to also assess your eyes for accommodation. To do this, Emily, I'm just going to have you look right at my finger. Now I want you to look at the wall that's behind me and back at my finger. So basically what just happened is that when you looked at my finger, your pupils constricted. When you looked at the wall, they dilated, which just means they widened. When you looked back at my finger, they constricted. And that's accommodation. Okay? So next, I'm going to assess your eyes for extraocular movements with the 6 cardinal fields of gaze. Okay? Just want you to follow my finger with just your eyes. Keep your head still. All right? And what I'm looking for are beats of nystagmus at the extremes. A few beats are normal. Very good. So
Was that normal?
That was normal. There were no extraocular movements of your eyes at the extremes. So this also tested the function of cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens respectively. Okay? Next, we're going to test your visual fields. And to do this, I'm just going to have you cover your right eye. Okay? I'm going to cover the opposite eye. And I want you to tell me when you can see my hand come into view, okay?
Now.
Okay.
Now.
Very good. Let's switch eyes.
Now. Now.
Very good. So this tested cranial nerve 2, which is the optic nerve, and it's functioning. All right?
Great.
Next, we're going to check your visual acuity. Can you tell me, do you wear contact lenses?
I do.
And are you wearing them right now?
Yes.
Okay. So to do that, I'm going to use a Snellen chart. And this is a Snellen chart. I'm just going to hold this about 14 inches away from your face. Could I have you cover your right eye, please?
Sure.
Okay. Now I want you to read the smallest line that you can read from left to right.
4, 2, 6, 7, 3, 9. E, W, M, O, O, X.
Okay. So with your left eye, you read the bottommost line. And basically what that means is that you have 20/20 vision. Okay?
Is that good?
That is good in your left eye. Okay? Now let's test your right eye. The same thing. So cover your left eye and do the same thing. The smallest line that you can read from left to right.
4, 2, 6, 7, 3, 9. E, W, M, O, O, X.
Okay. So the same line. So basically what that means is that with your contact lenses, you have perfect vision, or 20/20 vision, okay? And that also tested cranial nerve 2, which is your optic nerve, okay? So this concludes the examination of the eyes. Okay, Emily, next I'm just going to be assessing your ears. First, I'm just going to look anterior and posterior to your auricles, looking for any lesions. Same thing on this side. Anterior and posteriorly, okay. Next, I'm just going to palpate your auricles, okay? Let me know if you have any pain. How about in your pinna? How about the tragus
No.
and your mastoid process?
No.
Any
that's
pain?
fine.
Very good. Okay, Emily, so next I'm just going to look inside your external ear structure. Just turn for me, thank you. I'm looking for any lesions, cerumen, also known as earwax, or drainage, and there is none. I'm also going to look on this side. Just turn for me. Thank you. Okay. So your ears are clear. Next, I'm going to look inside your ear. I want to look at your tympanic membrane, okay? And to do that, I need an otoscope, okay?
Okay.
All right. Okay. I'm just going to have you turn your head for me. Just that way. Thank you. Just going to pull your auricle up and back. You shouldn't feel any discomfort with this. Okay, so your tympanic membrane is intact. It's a pearly gray. I can see the landmarks, and I see that the cone of light is at about 5 o'clock, and that's good. All right. And now for the left side. Just going to pull your auricle up and back. I'm just going to visualize your tympanic membrane. Very good. I see that it's intact. It's pearly gray. The landmarks, namely the incus and the malleus, are in place. And I also see the cone of light at about 7 o'clock. And that is normal. Okay?
Okay.
So lastly, we're going to test your acoustic nerve, which is cranial nerve 8, and this tests your hearing. Okay? So I want to have you occlude that ear with one finger. Okay. Now I'm going to whisper a 2-syllable word. I want you to tell me what you hear. Okay?
Okay. Apple.
Very good. Now switch ears.
Kitchen.
Very good. So that shows that cranial nerve 8, the acoustic nerve, is functioning. And that concludes the examination of the ears. Okay? Next, we're going to be moving on to the examination of your nose. I'm just going to palpate the external structure and the skeleton of your nose, okay? Just to make sure it's intact. Okay, any pain with that?
No.
Okay, next I'm actually going to look up your nose. And to do that, I need to use the otoscope again. This is a clean piece, okay? Could you tilt your head back for me?
Is that okay?
That's good. Okay, so I'm just looking at your septum first, looking for deviation or perforation, and there is none. I see that your mucosa are nice and pink, and your turbinates are deep pinkish. There's no erythema, swelling, or lesions, so that's good. Okay, so now for the other side. Same thing. I'm sorry, this is uncomfortable. Okay, so your septum is intact on this side as well. Your turbinates and your mucosa are pink. There are no lesions. There is no swelling or erythema. All right. And lastly, I'm just going to palpate your frontal and your maxillary sinuses. I want you to tell me if you have any pain or tenderness with this, okay?
Okay.
All right. Any tenderness?
No. Feels fine.
How about there?
Nope.
Very good. Okay, so that concludes the examination of your nose. And next, I'm going to move on to your mouth, okay? I'm just going to be looking for any lesions, any dryness. I see that you have nice lip gloss on. Can you just open your lips just a little bit so I can see the corners? Okay, you have no lesions. Okay, next I'm going to look inside your mouth, and for that I need a light, okay? This is a tongue blade. I'm just going to use it to depress your lips so I can see your teeth and your gums, okay?
Okay.
So open your mouth for me. Okay. Just looking at your teeth and your gums. I'm looking for erythema, swelling, or bleeding of your gums. Okay. Also looking at the upper gums. Okay. Very good. And just open your mouth for me a little bit wider so I can see your teeth. I see that you have a few repairs but no missing teeth. Okay. Very good. Next, I'm going to look at your buccal mucosa, which is just the mucosa against your cheek. Okay, so open your mouth for me one more time. I'm looking for lesions, and there are none. Okay. Now, could you stick out your tongue for me so I can see your tongue? Very good. Just want to see that it's normally papillated. Also looking for any coating, and there is none. Lift up your tongue for me. Okay, I'm looking under for lesions, and also to make sure that your salivary glands are patent, because there's saliva under there. Okay, that's very good. One more time, open your mouth for me. Okay, now I'm looking at your hard palate, looking for any lesions. Also at your soft palate. Okay, stick out your tongue straight at me. Okay, so this tests cranial nerve 12, which is the hypoglossal nerve, and that's functioning. So now say ah for me.
Ah.
Very good. So when you said ah, your soft palate and your uvula rose in midline, and that tests cranial nerves 9 and 10, the glossopharyngeal and the vagus nerves, okay? Now I'm going to check your tonsils. Okay, I see that you have them. Stick out your tongue for me. Very good. And they're about a 1 in size, pretty small. And I also see that you have no redness, erythema, or exudate on your tonsils. And one last time. And your posterior pharynx is also not erythematous, or it doesn't have any exudates, and no swelling, so that's good. Any soreness back there?
No.
No. Very good. Okay, so that concludes the examination of the mouth, and everything is normal, okay? Just gonna put this down. Next, Emily, I'm gonna be assessing your lymph nodes. Could you just tuck your hair behind your ear one more time for me? Thank you. So to start, I'm gonna palpate in a circular motion, starting with the preauricular. Okay. Postauricular, and I'm looking for any enlarged nodes or tenderness or nodes that are not mobile. Occipital, and just let me know if there's any tenderness, okay?
Okay.
Tonsillar, submandibular, submental, and now for the anterior cervical, superficial cervical, moving down your sternocleidomastoid muscle, your deep cervical chain, posterior cervical, supraclavicular, infraclavicular, and your epitrochlea. I'm just going to hold your arm like this. Just bend it for me, just like that. Very good. Now for this side, just bend your arm for me. Very good. You have a few more lymph nodes, but I'll be checking those with other systems, okay?
Okay.
So moving on from your lymph nodes, next I'm going to examine your neck. All right? First, I'm just going to looking for any swelling. Okay, there is none. And next, I'm just going to inspect that your trachea, which is your windpipe, is midline, okay? And to do that, I'm just going to find your sternal notch right here, and I'm going to go on either side of it, palpating to see that it's midline. Very good. Okay, Emily, next I'm just looking for any swelling right under the cricoid cartilage, which would signify any swelling in your thyroid. I don't see any. I'm actually going to palpate as well. To do that, I'm just going to have you take some sips of water when I tell you to do so, and just hold them in your mouth, and when I tell you to swallow, please swallow, okay?
Mm-hmm.
This might be a little bit uncomfortable, but it shouldn't hurt.
Okay.
Okay. So this is your cricoid cartilage right here. I'm going to make sure that my hands are on either side, curved around your sternocleidomastoid muscle between that and your trachea. Okay, now take a sip of water and hold it. All right, now can you swallow for me? Very good. So when you swallow, I can feel your thyroid move up and down. And now for the left side, take a sip of water for me and hold it. Okay, now swallow. Very good. So I couldn't feel any swelling, any nodules, and was that painful for you?
No.
Good,
it's
so there's
okay.
no tenderness. Very good, so that's a normal thyroid exam, okay?
Okay.
And lastly, I'm gonna palpate your carotid pulses. I'm gonna do one side at a time, okay? Starting with your right side, I'm just gonna have you turn your head a little bit. I'm just gonna palpate it very lightly. Very good, it's present, which is good. And it's about a 2+. Same thing on this side. Very good. And they're equal, and this is present as well at about a 2+. Next, I'm actually going to listen to your carotid arteries with the bell of my stethoscope, listening for any bruits. What a bruit is a sound. It sounds like a blowing sound, and it's caused by turbulent blood flow. Okay? All right.
What would a bruit mean?
A bruit could mean that you actually have an occlusion, which just means a blockage that's making the artery smaller than it should be. And so when the blood is trying to rush past that blockage, it sounds turbulent. So almost like a blowing sound. Okay? I'm going to use the bell of my stethoscope. Just going to palpate so I make sure I'm on the right spot. Okay. Could you take a deep breath and hold it for me? Very good. Thank you. The reason I had you hold your breath is so that I could hear better, because your breathing can also be very loud in that area. Okay? Gonna palpate one more time. Okay. Now hold your breath for me. Very good. Let it out. Okay, so there are no bruits present.
Great.
And that concludes the neck examination. So now we'll be moving on to the examination of your thorax and your lungs, okay?
Mm-hmm.
Okay, so first I'm just going to start by inspecting your lateral to anterior-posterior diameter. And the ratios should be about 2:1, and yours is about that, okay? So next I'm just going to percuss on your back. And basically what that means is I'm going to be tapping on your back. And the sound that I want to hear is resonance, and that shows that there's air throughout your lungs, and there isn't anything there like a pneumonia or a mass that could be benign or cancerous or anything like that, okay?
Okay.
This shouldn't be painful, all right?
All right.
Okay. And I'm going to go systematically, almost like in a ladder fashion. So see how that just got a little bit dull right there?
Yeah.
So what that means is I'm at the level of your diaphragm. And since your diaphragm is solid, the sound changed from resonance to dullness. Okay?
Okay.
Very good. Okay, so next I'm actually going to auscultate, which just means I'm going to listen to your lungs, and I'm listening in the same fashion that I percussed. I'm listening for any adventitious breath sounds, such as wheezing, which is a high-pitched sound, rhonchi, which is more rough, crackles, which sounds like hair being rubbed together. Okay? Your lung sound should be clear and what's called vesicular throughout. Okay? I'll be listening on the back and on the front. Also, please let me know if at any point you start to get dizzy. I know breathing in and out can actually make you dizzy, so just let me know, okay? Thank you. Breathe in and out. 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 In, out. In and out. In and out. In and out. In and out. And one more time. And out. Perfect. So your lungs are clear throughout and the lung sounds are vesicular on the posterior. Now I'm going to listen on the anterior side, okay?
Okay.
Breathe in for me. And out. In. And out. In. And out. In. And out. Okay. In. And out. In. And out. Perfect. So your lung sounds are equal bilaterally in the posterior and on the anterior. No adventitious breath sounds, and they're vesicular. Okay?
Okay.
Okay, Emily, so next I'm going to test for transmitted breath sounds, namely bronchophony and egophony. And at the end, I'll tell you what the results mean, okay?
Okay.
For bronchophony, every time I place my stethoscope on your back, I want you to say 99, okay? And we're going to do that throughout your back. And then for egophony, every time I place the stethoscope on your back, I want you to say E, okay? Starting with bronchophony. Okay, 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect. So when you said 99, what I heard was a muffled and almost indistinct 99, and that's good. So if I had heard the 99 as clear and louder, that could mean that you have a pneumonia somewhere, okay? More like a lobar pneumonia, all right? So next I'm going to test for egophony, and I'm going to have you say E every time I put this on your back, okay?
E. 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 Very good. So when you said E, what I heard was a muffled E. Now if I had heard A instead, that could also mean that you have a consolidation or a lobar pneumonia, okay? So those results are normal. Good.
Okay? Okay, so that concludes the examination of the thorax and the lungs. Everything was normal. So next we're going to do the breast exam, but I'm just going to talk through how you would do it, okay? First, I would start by inspection of the breasts, looking at the size, the contour, the symmetry, as well as looking at the skin for any lesions, skin of the breast, the areola, and the nipples for any lesions. So next, I'm just going to inspect your breast in different positions that can reveal any retractions or any dimpling, okay?
Okay.
First, I'll start with your hands over your head, just like that. Okay. So I'm just going to observe for any dimpling or any retractions. And then I would have you put your hands on your hips and just press your hands against your hips, just like that. Okay. And I'm looking for any retraction or dimpling. And lastly, I'm just going to have you lean forward for me, just like that. And this position can also reveal any dimpling or retraction. So when you lean forward, it might actually pull upwards, revealing that you have something that's attached to the fascia of your muscle. Okay?
Okay.
Okay. Sit back for me. Next, I'm going to palpate the lymph nodes. All right? Just put your hands just like that. Thank you for me. All right. Starting with the central. looking for any immobile or tender lymph nodes, enlarged lymph nodes. Lateral, pectoral, and subscapular. Okay, and that was normal. Next, I would have you actually lay down on your back so that I could palpate your breasts, all right? And for each side, so for the right side, I would have you put your hand over your head just like that. And starting at the tail of Spence, I would palpate in concentric circles, making sure to palpate every part of the breast tissue. And I would move in circles closer to the areola, palpating throughout, looking for any masses, any tenderness. And then I would palpate the areola as well, and then lightly pinch the nipples, looking for any discharge. And I would do that for both sides, okay?
Okay.
Now, if none of those were present and no retraction, no dimpling, no discharge from your nipples, and no tenderness, that would be a normal breast exam. It's also a good idea to do these at home on your own, and you could do them in the shower, especially after your period, because your breasts are less nodular, okay? And you would just palpate them in the same fashion that I did.
How often?
Once a month is fine.
Okay.
Okay, Emily, so that concludes the breast exam and everything was normal, okay?
Okay.
So next we're going to move on to the heart exam. I'm just going to have you scooch up and lay on the bed for me, on your back. Thank you. Perfect. You can lay back.
Okay.
Is this comfortable for you?
Yep.
Okay. So first, I'm just going to start by assessing your jugular vein on the right side. So just turn your head to the left for me. Thank you. And I'm just going to look for it first, see that I can see the pulsations. And I see them right here. Sometimes it's a good idea to use tangential lighting if you can't see it. So I could just shine a light like this, and I see it right there. Next, I'm going to measure from your sternal angle. So to do that, I'm going to place a ruler right on your sternal angle. To find that, I'll place my hand on your sternal notch and just slide my fingers downwards till I feel a ridge or bump. Yours is right there. Then I'm just going to measure from that point to the highest point of pulsations. And yours is about 3 centimeters. Normal is between 3 and 4 centimeters, so that's good. So this measurement basically estimates internal jugular venous pressure. All right?
All right.
So that's a normal exam. Moving on, I'm just going to inspect your chest or your precordium, looking for any heaves or lifts or any visible movements on your chest, which might indicate an enlarged heart. I don't see any. Next, I'm going to palpate for any thrills or pulsations. Next, I'm going to auscultate. Now, those 4 areas I just palpated are called the aortic, the pulmonic. These are both in the second intercostal spaces. The tricuspid is at the left lower sternal border, and the mitral is at the 4th or 5th intercostal space, mid-clavicular line. I'm going to auscultate there first using the diaphragm of my stethoscope. This is good for hearing higher pitched sounds, such as the S1 and the S2, which are basically the contraction and relaxation of your heart. Okay?
Okay.
I'm just going to pass my stethoscope this way. And lastly, the mitral area. Very good. Next, I'm going to listen in the opposite direction using the bell of my stethoscope. This is better for picking up lower pitch sounds such as S3 and S4 sounds, which are basically sounds that should not be there. Okay?
Mm-hmm.
Okay. Okay, so by my auscultation, your rate is regular. There are normal S1 and S2 sounds, and there are no S3 or S4 sounds. Lastly, I'm just going to listen for any murmurs. I'm going to listen in the mitral area for any mitral murmurs, and to do that, I'm going to listen with my bell, and I'm going to have you just kind of turn over onto your left side, okay? Mm-hmm. All right, just turn over for me. Very good. Maybe come back. Next, I'm going to listen for any aortic murmurs. To do that, I'm just going to have you sit up and lean forward for me, okay? And I'll listen with the diaphragm of my stethoscope.
Okay.
Thank you. Very good. No murmurs present. You can lay back, please. Thank you. And lastly, I'm just going to palpate your apical pulse. Your apical pulse is also in the same area that the mitral is. So the mitral area is. So to palpate it, I'm just going to go under your shirt here. Is that okay? Mm-hmm. Okay. I'm going to palpate at the mid-clavicular line, around the 4th or 5th intercostal space. And basically what this is when your heart contracts and it kind of rubs up against your chest, that's what the apical pulse is. That's what you feel. It feels like a tapping sound, and the amplitude is smaller than the S1 or S2, okay? And I can feel yours just fine. So normally I would measure this. I would actually count the rate of it. I would stand here for 60 seconds and count how many beats that I heard, okay? And I'm also assessing to see that it's regular, and yours is, all right? So now that concludes the heart exam. Next, we're going to be moving on to the peripheral vascular exam, okay? For that, I'm just going to palpate your pulses throughout your body, okay? Starting with your temporal pulse. And I'm just checking to see that they're symmetrical and normal amplitude. Okay. Next, I'm going to palpate your radial pulses. Checking for equality and amplitude. Very good. Next, I'm going to palpate your femoral pulse, okay? That's right here. And I'm palpating for equality as well as amplitude. And now onto your popliteal pulses. Just bend your knee for me. This pulse might be hard to get on some patients. So yours is not palpable, but that's normal with a lot of patients, okay? I'm just going to have you bend this knee. Thank you. Also not palpable, but that's normal. Okay, so next I'm going to palpate your dorsalis pedis. So they're equal. Same amplitude, and your posterior tibialis. And these are also equal and the same amplitude. So your pulses are equal throughout and about a 2+ throughout your body, and that's good and that's normal.
Okay.
Next, I'm just going to inspect your legs for any arterial insufficiency, which could be redness. On people that have hair on their feet, you might see hairless feet and toes. You might see some shininess of the skin. Your skin looks normal. No signs of insufficiency, arterial insufficiency. And next, I'm just going to look for any varicosities on your legs. Just going to lift your legs here. Should look under. Okay. All right. So no signs of varicosities. I'm also going to inspect your legs for edema, or also called swelling. I'm also going to palpate for this. Okay, no signs of edema. Very good. That concludes the peripheral vascular exam. Next, I'm going to move on to the abdominal exam, okay? And for this exam, I also want to have you laying down, but I'm actually going to lay you flat. Is that okay?
Yeah.
Okay, thank you. Okay. Are you comfortable?
Yeah.
Are you ticklish?
Yes.
Okay. So I'm just going to expose your stomach. Is that all right?
Yes.
Thank you. Okay. So first, I'm just going to start by inspecting your stomach. See, looking for the contour of your stomach. And yours is pretty much flat. Looking for any masses. I'm also looking at the skin of your stomach, looking for any lesions or scarring that might indicate surgery. And there is none. Okay, next I'm just going to auscultate all 4 quadrants of your stomach, okay? And then after that I'll percuss, all right?
Okay.
So what I'm looking for with auscultation is anywhere from between 5 to 34 bowel sounds per minute. And that shows that your bowel sounds are normal active. And yours are in all 4 quadrants, okay?
Okay.
Next, I'm going to auscultate your aorta and your renal arteries for bruits, okay? And to do that, I'm going to use the bell of my stethoscope. Okay, now the renal arteries. So there are no bruits heard, and that's normal. Moving on, I'm going to percuss your abdomen in the same way that I went for the auscultation. This shouldn't hurt, okay? And the sound that I'm looking for is tympany, which basically shows that there's air in your stomach. There might be some areas of dullness diffusely, but that's normal, okay? That could just show that you have fecal matter in your intestines, as you should. Okay. Okay, so did you hear that sound? So that was tympany. So that shows that there is air in your stomach, as there should be. Do you have any pain with that?
No, it felt
Okay.
fine.
Very good. So lastly, I'm going to deeply palpate your flanks, looking for any pain, tenderness, or masses. Any pain?
Nope.
Very good. So next, we're going to do some special maneuvers. And these maneuvers are just to determine if a patient has an acute abdomen, okay? First, we're going to start with what's called rebound tenderness. I'm going to depress the lower right quadrant of your stomach and release sharply. When I release, if you feel pain in the right side, lower abdomen, then that's a positive rebound tenderness, okay?
Okay.
Any pain with that?
Just pressure as you pushed.
Okay, so that's a negative test. So next, we're going to do the psoas sign. To do that, I'm just going to have you lift your right leg against the pressure of my hand, okay? Let me know if you feel pain with this. Did you have any pain with that?
No.
Okay, so that's a negative test. If you had had pain when I did that, that would mean that your psoas muscle has been irritated by an inflamed appendix, okay?
Yes.
The next test is the obturator sign. To do that, I'm just going to have you flex your hip and your knees. Then I'm going to internally rotate. Do you have any pain with that?
No.
Very good. So that's a negative test. If you had had pain with that, that would mean that your obturator muscle has been irritated by also an inflamed appendix. So all of those tests were negative. Next, I'm actually going to expose your abdomen again. Is that okay?
Yes.
All right. Next, we're going to palpate for the liver span, okay? So normally the liver span is between 6 and 12 centimeters. To do that, I'm going to palpate upwards from tympany to a place of dullness. I'm going to note that spot, and then I'm going to palpate downwards to a place of dullness and note that spot. And the distance between the two spots would be your liver span, okay? All right. So I'm going to start at the mid-clavicular line, your lower abdomen. You hear that? Okay. So that's dullness. All right. Could I just have you just hold your breast up, the right one, with use your right hand. Thank you. Up and to the side if you can for me.
Okay.
I'm going to palpate downwards. You hear that dullness? So now I would measure the distance between those two spots, okay? Approximately between 6 centimeters and 12 centimeters, so it's within the normal range, okay? Next, I'm actually going to try and palpate the edge of your liver. So to do this, I'm going to stand up top here, and I'm actually going to palpate under your costal margin, which is where your ribs stop, basically. I'm going to have you take a deep breath, okay? All right. Can we do that one more time? Take a deep breath for me. All right, and let it out. Very good. So basically what I'm looking for is for your liver to come down when you take a deep breath and just bump up against my hand, okay? Against the tip of my fingers. And it should feel nice and demarcated, okay? Okay, Emily, so next I'm going to percuss along your left costal margin. I'm percussing to listen for any enlargement of your spleen. I'm going to start medially and move laterally to beyond your anterior axillary and your mid-axillary line. So what I should hear is tympany as I percuss, okay? Now if I hear dullness before your mid-axillary or your anterior axillary line, it could mean that your spleen is enlarged, okay? All right, very good. Next, I'm actually going to palpate for your spleen, okay? Almost in the same way that I did for your liver, but this time I'm going to reach over you. Is that okay?
Yes.
So I'm just going to reach over, and I'm going to make sure that my hand is well below your costal margin. Now, could you take a deep breath in for me? Okay, you can let it out. Very good. So when you took a deep breath in, what I was looking for was to feel if your spleen would bump up against my fingers, and it did not. So that shows that your spleen is not enlarged. Okay? Lastly, I'm just going to have you sit up, and I want to check for what's called CVA tenderness, okay? And this would tell me if you had any infections going on in your kidney. Just going to lift up your shirt here. I want you to tell me if you feel any pain with this, okay? Just going to tap on your back. Any pain with that?
No.
Very good. So that's negative CVA tenderness. Thank you. You can lay back down for me. Thank you. So that concludes the abdominal exam. Next, I'm going to actually do the musculoskeletal exam. But first, I'll do the hips because it's easier to have you laying down for this exam. Okay?
Okay.
So first, I'm just going to palpate a landmark, which is your greater trochanter on either side. Okay. Any pain with that?
No.
Very good. So next, I'm going to do a few maneuvers just to test the movement of your hip joint, okay? First, placing my hand here just for support, I'm going to have you flex. And just bend your knee. Very good. So that's flexion. Any pain with that?
Nope.
And I didn't feel any crepitus or any crunching. Could you just move towards the edge of the bed so that your right side is almost at the edge? Keep coming. One more time. Okay, very good. Now I'm just going to have you drop your right leg off the bed. Okay. And that tests for extension. Alternately, I could just have you roll on your left side. And I'm just going to pull your right leg backwards just like this. Does that hurt? Very good. Okay, now you can lay on your back. Thank you. Next, I'm going to test internal rotation, external rotation. All right. So that one more time so I can palpate. Internal rotation, external rotation. Any pain with that?
No.
Good, I didn't feel any crepitus. Now we're going to test abduction. Any pain? And adduction. Any pain with that? Very good.
No.
And I'm looking for any crepitus or any crunching of the joints. And there was no pain while I did that, correct? Okay, Emily. So then I would walk around to the left side and do the exact same thing for your left leg, okay? So next, I'm going to do the rest of your body. Could I just have you come back to the edge of the bed for me, please?
Okay.
Thank you. Okay, so now we're going to do the rest of the musculoskeletal exam, okay? I'm going to start with your temporomandibular joint. Just going to palpate. Could I have you open your mouth, please? And close. Any pain with that? Very good. I didn't feel any clicking, so that's good. Okay, Emily, could I just have you hold your hair up with your left hand and just turn your head towards the left, okay? Thank you. So I'm going to palpate your cervical spine, making sure it's in a straight line. and also for any tenderness. I'm also going to palpate the paravertebral muscles on either side of your cervical spine, looking for any tension. Any pain with that?
No.
Very good. Lastly, you can drop your hair. I'm actually going to go through a few movements with you, okay? Just to test the motion of your cervical spine. So first, I'm going to have you touch your chin to your chest for flexion. Very good. Now look up at the ceiling for extension. Very good. Any pain with that?
No.
Okay. I want you to touch your right ear to your right shoulder for lateral bending. Any pain with that?
Mm-mm.
Okay. And now the other side. Very good. And now could you please look to your left for rotation and look to your right? Very good. Any pain with that?
No.
Very good. So that tested the cervical spine. Everything looks normal, full range of motion, and no tenderness with any of the movements, correct?
Correct.
Okay. So next, Emily, I'm going to examine your right shoulder. I'm going to start by examining your acromioclavicular joint, which is, I'm just going to find your acromion, and it's right here. I'm going to palpate it. Next, I'm going to palpate your glenohumeral joints, right here. And lastly, I'm going to palpate your bicipital groove. Okay? Put your arm out. There we go. Okay. So now, I'm going to do some range of motion exercises with your shoulder, okay? First, I'm going to have you flex your shoulder to 90 degrees and then to 180 degrees. Okay? You do that for me? 90, 180. Any pain with that?
Mm-mm.
Okay, you can come down. And I'm going to have you extend your shoulder behind you. Okay? It's a little hard when you're sitting, I understand. Very good. Any pain with that?
No.
Okay. Now we're going to abduct your shoulder, so out to the side. Very good. And now just bring it across your chest for adduction. Very good. Bring it down. Okay, next, Emily, I'm going to have you internally rotate your shoulder. So I want to have you reach behind your back and try to touch the opposite scapula. All right, and bring it back around. Very good. Any pain with that?
No.
Okay. Now I'm just going to have you lift your arm out to the side with your elbow bent. Bend your elbow, and now lift it up. Very good. And that's external rotation. Any pain with that?
Mm-mm.
Very good. So Emily, next we're going to examine your elbow. Just going to look at the landmarks, the humeral epicondyles, and the olecranon process. Next, we're going to do range of motion exercises. First, I'm going to have you flex and then extend your elbow. Very good. And now just follow me. So this is supination, and this is pronation. Can you do it for me? Supination, pronation. Any pain with that?
No.
Very good. Okay, so moving on, we're going to examine your wrists. First, the ulnar styloid and the radial styloid. Then I'm going to palpate your carpal bones. Any pain with that?
No.
Okay. So next I'm just going to model some range of motion exercises for you. So just follow me. We're going to flex, extend, ulnar deviation, radial deviation. And any pain with that?
No.
Okay, very good. So next we're going to palpate the bones of the hand, okay? So starting with the metacarpals, just going to palpate down each one. Okay. And the metacarpophalangeal joints, or the MCP joints. The proximal interphalangeal joints. And the distal interphalangeal joints. Okay, so next we're going to do some range of motion exercises with the hand. So I want you to follow me, okay? So we're going to flex, extend, abduction, spreading your fingers, and adduction, bringing them back together. We're also going to do this for the thumb, okay? So just follow me. Flexion, extension, abduction, adduction, and opposition. Touch each finger. Very good. All right, so we would do the exact same thing for the left hand. And that concludes the examination of the upper extremities. Moving on, next I'm going to examine your knee. I'm just going to stoop down here so I can see better. So first I'm going to palpate the landmarks. So I'm going to palpate the femoral condyle, tibial condyle, the lateral joint space, the medial joint space, and the tibial tuberosity. Okay? Was there any pain with that? Okay.
No.
So your knees are already in the flex position, but I'm just going to have you bend them a little bit more. If you can just lift up your leg and bend your knee. Any pain with that?
No.
Okay. So now I'm going to have you straighten your leg for extension. Very good. Any pain with that?
No.
Okay. So next, I'm going to assess your ankles. Could I just have you scooch back so that your feet are on the bed? Thank you.
Is that okay?
Just a little bit more. Thank you. So next, we're just going to assess your ankles. Could I just have you open up your legs just a little bit? Thank you. First, I'm assessing the landmarks, starting with your medial malleolus and the lateral malleolus. Did you have any pain with that?
No.
Okay. And then for flexion, I'm going to have you point your toes. So could you point your toes for me?
Mm-hmm.
Very good. And now for extension, I'm going to have you pull your toes backwards towards the sky. Very good. Any pain with that?
No.
Okay. Next, I'm going to have you invert. So turn your ankles in this way and evert the other way. Very good. Any pain with that?
No.
Okay. Next, I'm going to palpate the bones of your foot. So starting with the tarsals and your metatarsals. You have any pain with that?
No.
Good. Then I'm going to palpate the MTP joints, the PIPs, and the DIPs. Did you have any pain with that?
No.
Okay, very good. And now for flexion of your toes, I'm just going to have you curl your toes into a ball. Okay, and now just extend them. That's extension. And now can you widen your toes and just put as much space as you can between them. All right, that's abduction, and just bring them back together. That's adduction. So lastly, for the musculoskeletal system, I'm going to assess your spine. Okay? To do that, I actually need you standing up. All right? Perfect. I'm just going to model the movements for you and just follow me, okay? Okay, so first we're going to start by flexion and just follow me. So I'm going to flex, bend down and touch your toes. Very good. And now straighten up. And lean back from your waist, look up at the sky. That's extension. Okay, we're going to laterally bend, touch your left leg. Do the same thing for your right side. And now we're going to rotate towards your left. And now towards your right. Okay. And lastly, could I just have you turn around? I'm just going to palpate, turn a little bit more. Just going to palpate your sciatic notch for any pain. Any pain with that?
No.
Very good. Okay, you can sit back on the bed. That concludes the musculoskeletal exam. Next, we're going to move on to the neurological exam, okay?
Mm-hmm.
So first, I'm going to test your cognitive function. So I'm going to have you spell the word world backwards for me.
DLROW.
Very good. And next, I'm going to test your higher intellectual functioning.
Mm-hmm.
So could you just tell me what you would do if you were in a burning building?
So I'd find the emergency exit and go down the stairs.
Very good. So that tests your cognitive function and your higher intellectual function. So that's good. You passed that test. So moving on, we're just going to go through the rest of the cranial nerves. We did most of them, but I'm just going to go through them again, okay?
Mm-hmm.
So I started with the optic nerve, which is cranial nerve 2, and that tested your visual acuity and your visual fields. And then we tested cranial nerve 3, which tested your ocular motor nerve, and we did that by testing your response to light, your pupillary response to light, as well as your lid movements. Then we did cranial nerves 3, 4, and 6. Again, the ocular motor. 4 is the trochlear, and 6 is abducens. And that tested your extraocular movements. So we did not do the trigeminal nerve, which is number 5. So to do that, I'm going to test the motor and the sensory, okay? To test the motor, I'm just going to have you bite down on either side on this tongue blade. Don't let me pull it out, okay?
Mm-hmm.
All right, and this tests the motor. Bite down. Very good. And now on the left side, bite down. Very good. So that shows that the motor portion of your trigeminal nerve is functioning. So next, I'm going to test the sensory portion of your trigeminal nerve. And to do that, I'm just going to use this little piece right here. It has a cotton ball on the end, and the other end is just a little bit sharp, okay? Could you close your eyes for me? So this is the soft part, and this is sharp, okay? Tell me what you feel, if you feel dull or sharp.
Sharp. Soft. Sharp. Sharp.
Okay, now for the other side.
Soft. Sharp. Sharp.
Very good. So the sensory portion of your trigeminal nerve is also functioning. Okay, so moving on, the facial nerve is number 7, and this is only a motor component. So could you wrinkle your forehead for me? Okay, now smile. All right, now frown. Very good. So that shows that your facial nerve is functioning. We already tested your acoustic nerve, which is cranial nerve number 8. We did that with the whisper test. And numbers 9 and 10, the glossopharyngeal and the vagus were tested with your uvula rising and midline. So those are functioning. So for number 11, which is the spinal accessory, I'm going to have you shrug your shoulders against my hands and don't let me push them down, okay? So shrug. Very good. Now turn your face against my hand. Very good. Very good. So your cranial nerve number 11, the spinal accessory, is functioning. And number 12, we already tested, and we did that when you stuck your tongue straight out at me and it stuck out in midline, okay? So that concludes the cranial nerves. Next, I'm going to assess your motor function. To begin, I'm just going to inspect the general muscle bulk, looking for any differences in size in your muscles. Everything looks pretty even. And next, I'm just looking for any fasciculations or tremors in your muscles. Everything looks steady. And next, I'm going to test the strength in your upper and then your lower extremities, okay? So I want you to make a muscle with both hands. Now, don't let me pull it down. Very good. Now, push out against my hands. Push in against my hands. Push out against my hands. Very good. And now for your lower legs, could you just lift up against my hand? Okay, lift up. Now push out against my hands with both of your legs. Okay, push in. Okay. Now I want you to push out against my hands with both of your legs. Very good. Okay, pull up. And now push down like you're stepping on a gas pedal. Very good. So your strength is 5 out of 5 throughout. That just means that you have full strength.
So
Okay.
5 is good.
5 is good. So lastly, I want you to squeeze my hands as tightly as you can. Very good. So that's equal strength in both hands, and that's good. Okay? Now I'm going to test your shoulder girdle. Could I just have you put your arms directly out in front of you and turn your palms towards the sky and just leave them there. Okay? So what I'm looking for is any drifting of either of your hands and any pronation, and there isn't any. Pronation would mean that your hand is coming down and then turning downwards. Okay, very good. So next, we're going to test the sensory portion of your neurological function, okay? And to do that, I'm going to use this again, all right? Could you close your eyes for me? This is soft, and this is sharp, okay? And I'm going to do that along your upper extremities and your lower extremities, okay? So just tell me when you feel soft and when you feel sharp. Starting now.
Soft. 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 Sharp. Soft. Sharp. Sharp.
Okay.
Soft. Sharp. Soft. Soft.
Okay. And now for your legs, the same thing.
Sharp. 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 Soft. Sharp. Soft.
Okay. And now for your left leg.
Sharp. Sharp. Soft. Sharp. Oh, soft, excuse me. Soft. Soft. Sharp. Soft.
Very good. So that concludes the test for sensory in your upper and lower extremities. Next, we're going to test for position sense and vibration sense in both your upper and lower extremities, okay? First, we'll do vibratory sense. To do that, I need a tuning fork. So what I'm going to do is I'll hit this on my hand, then I'll place it on your forefinger, just like this, and then I'm going to stop it. So I want you to tell me when you feel the vibration and when you feel it stop, okay? And I'll do that for both your fingers and your toes, all right? So hold out your hands for me. Close your eyes. All right.
I feel it, and it went away.
Okay.
I feel it, and it went away.
Very good. And now for your toes.
I feel it, went away. I feel it, it's gone.
Very good. So your vibratory sense is good. It's intact. Next, I'm going to test for position sense. Same thing, both your hands and your feet. So hold out your hands for me. To do this, this is up, this is down, okay? So I want you to close your eyes, and I want you to tell me which direction that your finger is in, all right? Starting now.
Down, up,
Okay,
up, down.
okay. Now for your toes.
Down, up.
Okay. All right. Now for your left foot.
Up, down.
Very good. So position sense is also intact. Okay, Emily, so that concludes the sensory portion of your neurological exam. Next, I'm going to test your deep tendon reflexes, okay? I'm going to start from the upper extremities and move down to the lower extremities. And I'm going to do this with my reflex hammer, okay? So first, I'm going to test your triceps reflex. So just let your arm dangle in my hand. Very good. Very good. And next, I'm going to test your biceps reflex. Relax your arm. Okay. Very good. And next, I'm going to test your brachioradialis. Relax your hand. Okay. Moving on to your lower extremities, I'm going to test your patellar. There we go. And I'm going to test your Achilles reflex, okay? To do that, I'm just going to dorsiflex your foot, and I'm going to hit your Achilles tendon. All right. So lastly, Emily, I'm going to test your plantar response. I'm just going to lift your leg up for this, okay? So what I'm going to do is I'm going to run this along the edges of your foot. It might be a bit uncomfortable. The response that I'm looking for is either curving of your toes or nothing at all, okay? Very good. So that was a negative Babinski. So that concludes the examination of the deep tendon reflexes. And next, we're going to do your cerebellar examination, okay?
Okay.
And this examines the function of the cerebellum of your brain. First, I'm going to have you do rapid movements with your hands and then with your feet, okay? And just do what I'm doing. So for your hands, could you just do this for me as quickly as you can? Very good. So that was nice and even and coordinated. And next, with your feet, I'm just going to have you paddle your feet just like this, as quickly as you can. Very good. So that concludes the coordination portion of the cerebellar exam. So next, I'm going to have you get off the bed and walk over here with me, okay?
Okay.
Thank you. So first, I'm going to have you just walk normally, take about 5 steps that way, and then turn around and heel to toe walk back towards me, okay? And I'll tell you when to stop. Starting now. Okay, you can turn around and now heel to toe walk towards me. Very good, you can stop right there. Okay, now lastly, I'm going to have you turn around, face that way. I'm going to come around in front of you. Okay, I'm going to have you stand with your feet together just like that. Lift your arms out in front of you with your palms to the ceiling and close your eyes and just stand there. Okay, so I'm looking for any excessive swaying, which there is none. I'm also looking for any drifting of your arm and pronation as well. And there is none. Very good. So you can drop your arms. And can I have you sit back on the bed? Thank you very much. Okay, Emily, so that concludes the head to toe examination. You passed with flying colors. Thank you so much for your patience. I appreciate it.
Thank you.